Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Thank you to our platform sponsor, J&J, for their unrestricted support of PH Insights. Sponsors do not endorse or participate in the development of program content. Hi, it's Angela, and welcome to this episode of PH Insights. Today, we're going to focus on sarcoidosis-related PH, and joining us to discuss this topic is Dr. Oksana Shlobin, who is the Medical Director of the Pulmonary Hypertension Program and the Director of Education and Outreach, Advanced Lung Disease and Transplant Program at Inova Fairfax Hospital. Dr. Shlobin, thank you for being here today.
It's my pleasure.
Thank you. So we're just going to jump right into it. You know, a lot of people, specifically newly diagnosed patients, are learning about pulmonary hypertension, but there are also some associated conditions related to PH. What is sarcoidosis-associated pulmonary hypertension, and how does it develop?
So sarcoidosis-associated pulmonary hypertension occurs in a setting of underlying lung disease, sarcoidosis. And sarcoidosis is a multi-system granulomatous lung disease that, given that it's multi-system, it can affect many different organs in someone's body. Lungs are the organs that are most commonly affected, and frequently patients may have just lymph nodes that are enlarged, for example. Or sometimes they may have sarcoidosis in the lung units themselves. When they have sarcoidosis in the lung units, it may be inflammation, but often it can be scarring, or the inflammation can become scarring. So one of the complications of sarcoidosis is pulmonary hypertension. And so pulmonary hypertension is elevated pressure, specifically in the lungs or pulmonary vasculature. And pulmonary hypertension can be classified in 5 different groups. And sarcoidosis falls actually in group 5 pulmonary hypertension. So group 5 pulmonary hypertension we call it a miscellaneous group. And the reason that we call it a miscellaneous group is because the pulmonary hypertension can occur due to different physiological phenomena, or etiology of pulmonary hypertension in patients with sarcoidosis can be different in different patients with sarcoidosis. So it's not the same mechanism that may be responsible for development of pulmonary hypertension in patients who have sarcoidosis. And so identifying what is the leading mechanism, or why someone with sarcoidosis has developed pulmonary hypertension, is something that we spend quite a lot of time on when we have a patient with sarcoidosis who presents with either diagnosed or suspicion of pulmonary hypertension.
When looking at those who are at risk, is there a specific demographic of those who have sarcoidosis and potentially develop pulmonary hypertension?
So the most common type of what we call SAPH, sarcoidosis-associated pulmonary hypertension, happens in patients who have parenchymal or interstitial lung disease. So the lung units are involved with sarcoidosis. And the most common type of parenchymal lung disease that we see in patients who have pulmonary hypertension is this scarring. It's scarring due to sarcoidosis, or in medical language we call it fibrocystic sarcoidosis. So those are the patients that are at risk for development of pulmonary hypertension versus, for example, patients who do not have fibrocystic disease or who have sarcoidosis that's not affecting their lungs. Now, we can talk about different types of sarcoid-associated PH, or different phenotypes in a little bit more detail. But again, patients who have fibrocystic disease are the ones that you'd consider to be at the highest risk of development of sarcoid-associated pulmonary hypertension.
With those who are at risk, are there like some key signs and symptoms they should look out for or monitor to help like determine this diagnosis?
Most of the time, it would be increased shortness of breath. It's sometimes tricky to tease out whether the symptoms of that someone is having are due to underlying parenchymal lung disease, for example, or whether they are due to developing pulmonary hypertension. And again, pulmonary hypertension and sarcoidosis can be caused by different mechanisms, and so presentation may be different a person to a person.
Based on the information you've shared so far, if there is a suspicion of SAPH, if a patient is thinking, this shortness of breath is lasting longer or this is happening, what do you recommend that they do, or how do you recommend they approach this with their healthcare team?
Usually, their patient's provider or their healthcare team would think about pulmonary hypertension as one of the possibilities for someone's increasing symptoms. So they are, I think the advice that we give patients usually is that you need to be honest about your symptoms, you need to monitor your symptoms and sort of be able to describe when they are different or why they're different or how they're different. So, but again, the most common symptoms that we see with pulmonary hypertension is worsening shortness of breath. It's not until someone sort of has developed failure of the right ventricle that we see a lot of other symptoms. So again, increased shortness of breath is something that patients should talk to their provider about. And in addition to investigating possible other causes of increased shortness of breath, usually the medical team would consider pulmonary hypertension in their differential diagnosis.
Are there specific specialists that a patient would see or they should include in their medical team, or just a pulmonary hypertension specialist is key to see? Obviously, if you have sarcoidosis, you will have your primary practitioner, but are there a specific specialist for SAPH?
Well, usually patients who have sarcoidosis are seen by a number of different specialists depending on what type of sarcoidosis they have, whether they have predominantly lung involvement or whether they have heart involvement. So there is such thing as cardiac sarcoidosis, or if they primarily have joint involvement, then they would have a rheumatologist, or skin involvement, then they would have a dermatologist. But again, lung involvement is the most common. And so a pulmonologist is usually a part of the team. Depending on their expertise and familiarity with pulmonary hypertension, if it is suspected, they would either work that up further or they would refer a patient to a pulmonary hypertension specialist.
And when referred to a specialist, I know a lot of our PH patients are very familiar with things like the 6-minute walk and different tests that are associated with PH. Are these similar tests that a SAPH patient would experience? The 6-minute walk, a chest scan, a CT scan, an echocardiogram, are those to be expected when you're trying to diagnose this?
Yes, this is something that we regularly do. We often use 6-minute walk test actually just in sarcoidosis patients to monitor for exertional hypoxemia or exertional oxygen levels and also exertional oxygen needs. So 6-minute walk test is something that we utilize just in patients who have sarcoidosis, not even SAPH specifically. And CAT scans are very important to evaluate both the parenchymal lung disease, but also look at the lymph nodes and the vessels, because as I mentioned, there are different types of sarcoid-associated pulmonary hypertension. And in some patients, it can develop even enlarged lymph node is pressing on the lung vessels, so large lung vessel. So it's not because they actually have abnormal vessels, small vessels in the lungs, but the lymph nodes actually pressing on the bigger lung vessels. So again, often we do specialized types of CAT scan to, again, specifically figure out why someone may have developed pulmonary hypertension. An echocardiogram is very important because patients with sarcoid can have a sarcoid of the heart, and if there's suspicion of that, then then they are usually seen by a cardiologist who specializes in cardiac sarcoidosis, and there's a whole other slew of tests that they undergo. But patients with sarcoidosis also can develop pulmonary hypertension due to abnormal function or abnormal left side of the heart. So it is also pulmonary hypertension, but it's pulmonary venous hypertension or elevated pressures in the lungs because the left side of the heart doesn't relax normally or it doesn't relax well. And so again, this phenotyping of patients or figuring out what is driving their pulmonary hypertension is actually probably more complicated in patients with sarcoidosis than in patients without sarcoidosis. So CAT scans are very important. Echocardiogram is very important. We do 6-minute walk tests. We do breathing tests. And obviously, right heart catheterization is very important to get the accurate numbers and, again, help us figure out what type of pulmonary hypertension someone has, because the type of pulmonary hypertension in sarcoidosis will dictate the treatment. And for example, if someone has a lymph node that is pressing on the big vessel, their treatment is going to be very different than if someone has abnormal relaxation of the left side of their heart, or if someone has scarring in their lungs. So very different treatment approaches.
So, and that is determined once you determine what is causing the pulmonary hypertension in the sarcoidosis patient. So those treatments will vary.
That's correct. Okay. Yes, and sometimes vary drastically. Yeah.
With the treatment, are there consistent or underlying medications that a patient typically will take? Are there ones that regardless of where it's diagnosed from, you will usually take these types of medications?
No, the approach is a little bit different than for patients with PAH, pulmonary arterial hypertension. The most important thing is to figure out what's causing elevated pressures. And once we figure it out, then you really want to treat, then you focus the treatment based on etiology or the reason for pulmonary hypertension. So again, if you have a big lymph node that's pressing on the big pulmonary artery, then often patients needs more treatment for sarcoidosis itself to shrink the lymph node. Sometimes people need a stent to open up that pulmonary artery. If someone has scarring in their lungs, then there are no approved treatments for patients who specifically for sarcoidosis due to scarring in their lungs, but there are some clinical trials that patients may be able to get into. And again, if it is because the left side of the heart is abnormal, then the treatment is really focused on treating the left side of the heart and reversing that pathology. So, and sometimes if you do not identify sort of the reason correctly, you can actually make people feel worse by using medications incorrectly.
Wow. So it's really important to make sure you're working with that team to determine the cause. Has there ever been a time where, someone presents or is told that they have pulmonary hypertension, and after testing, you realize it's actually SAPH or it's actually another underlying condition that led to the PH diagnosis that wasn't caught?
You mean someone was told that they have like group 1 pulmonary hypertension? Yes. Yeah, it's actually very common to have patients misdiagnosed. So, the most common type of pulmonary hypertension in the United States is actually due to left-sided heart disease. So, especially what we call diastolic dysfunction or heart failure with preserved ejection fraction. So again, this is not because the left side of the heart is not pumping well, but it's not relaxing well. And patients who have sarcoidosis, let's say that does not involve the lungs, are at higher risk of developing problems with the left side of their heart and the relaxation specifically of the left side of their heart. And some of it is because some often patients are on chronic steroids, and which chronic steroids often can lead to side effects like weight gain and diabetes and high blood pressure and coronary artery disease. And so all of those things can contribute to the problems with relaxation in the left side of the heart. So we see patients who are referred for SAPH, and then we determine that it's really the left side of the heart, which is not SAPH per se. I mean, we still put it under that category, but you treat it very differently. And sometimes, again, we find things like really big lymph nodes. It's not very common, but it does happen. So there is this working up a patient and really trying to make sure that you understand what is happening to them and why they're presenting with this elevated pressures of the heart is so important in this patient population.
I'm glad you clarified and gave a little bit more information about how easy it is for those to possibly be misdiagnosed or categorized in one, but it's really another group. I would also like to put out there for everyone that PHA is really committed to making sure that people find the best care. We do have accredited care centers across the United States. That is a resource that you can find on phassociation.org. Care centers, you can find someone local to you. They've gone through the accreditation process through PHA to make sure that they are giving patients the best care. So I just wanted to put that out there. And before we go, and I really appreciate you sharing all of this information with us, is there anything you would like to share with patients who may have the symptoms, may not fully understand? Any lasting messages that you can put out to our patient community?
I think great communication with the care team is very, very important. Because if you, as a patient, don't advocate for yourself, then the team may not hear the concerns, and it may result in delay of diagnosis, whether it is sarcoid-associated pulmonary hypertension or another problem. Because again, patients with sarcoidosis can have other things that happen to them. They have worsening of their disease or clots. And so communication with the team and remembering that that you sometimes you have to speak up and reach out if you are not feeling well. It goes a long way. So I always tell my patients that they have to advocate for themselves and communicate, and we will do our best to take good care of them.
Thank you so much, Dr. Shlobin. I appreciate you joining me. I feel like this was a great overview conversation. As with any information shared through PHA, we definitely recommend you reach out to your healthcare team to get the specifics for your diagnosis. We hope that this served as a general awareness of sarcoidosis-associated pulmonary hypertension. Thank you again, Dr. Shlobin. I appreciate you taking your time to join me and give this overview.
And thank you to PHA for all of the work that you guys do.
And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. And thank you to J&J for their unrestricted support of PH Insights.